Hi, everyone. Welcome to the Kind Health Group YouTube channel and podcast. Today we have an awesome guest, Jaime Levine. Jaime is the Director of Legal Services at Elder Law and Advocacy, a nonprofit law firm in San Diego. He has worked as an attorney on elder law and elder abuse cases for almost 20 years and has helped thousands of seniors to avoid, confront, and remedy their victimization. Services offered by Elder Law and Advocacy include representation of seniors in elder abuse restraining order filings and lawsuits against nursing homes for abuse and neglect. Thank you so much for being here today, Jaime, and we have lots of questions for you regarding our elderly population and the COVID-19 crisis. Thank you for taking the time. I know you're super busy.
My pleasure, and thank you for inviting me.
Welcome, Jaime.
Thank you.
So Annie has put together some great questions as kind of a springboard for us to start from. So I'll let you fire away, Annie.
And it couldn't be more timely to get the opportunity to talk to you right now. So I guess my first question is, what would you do if you have a loved one in a senior center and you don't have access right now?
A senior, to clarify, a senior care facility, not a
senior care facility.
Yeah.
Okay, well, there are multiple levels of senior care facilities. So the highest level of care being skilled nursing, and then there are lower levels of care as well. The news that we're hearing more about right now really pertains to skilled nursing facilities because the rate of infection, once it's introduced into one of those facilities, I'm talking COVID-19, the rate of infection is very high, and also the seniors are very susceptible to it. It's one of the populations, I mean, as you know, that is most susceptible to the coronavirus. And so there are all kinds of problems associated with that, including staff not wanting to show up to work, the facilities not allowing any guests. And by guests, I mean family members and friends. I mean the Department of Public Health for most situations. I mean attorneys, like the attorney in my office. Yeah, and ombudsmen. There are no ombudsmen, and ombudsmen really are the front line of defense when it comes to discovering and taking action for seniors who are really in desperate situations. So it's really a crisis beyond what most of us would really understand if you're talking about that kind of facility.
I was just reading on CNN, why aren't they allowing, like, why doesn't anyone have access? Why aren't we getting numbers? Why aren't they reporting what's happening?
Well,
solve it for me.
We are in a bit of an adversarial relationship with nursing home facilities. And the issue is that there's very little oversight. Most of the facilities are for profit, and of course they are at very high risk. So I think they're doing everything they can to avoid a panic. And they understand that even during the best of times, the oversight of these facilities is really quite minimal. And that's why an organization like ours is so important, because the Department of Public Health, they really don't have teeth when it comes to enforcement. There are certain rules, for example, minimum staffing rules that are in place, but the only thing the Department of Public Health ever really does is fine facilities when they discover that there's a staffing issue. And of course, now staffing issues are probably much more profound, but the facilities are never going to self-report that, because if they self-report it, they're going to be subject to fines. And really, there's no oversight now. Even communication with individuals who are residents in nursing homes is difficult. One of the things that I was taught, we have one attorney in our office who really is an expert on nursing home rights, Andrew Thompson. And his position at this point is there's not a lot that can be done. All you can really do is communicate with the people you know in the nursing facility and communicate with the facility itself. Communicate with the people you know who are residents, and reassure them, and find out from them what you can about what's actually going on inside, and then talk to the facility and find out what policies they have in place, what they're doing to ensure the safety of the residents, what they're doing to try to provide access. There is, I know there are a couple of facilities that are facilitating Zoom meetings with some of their residents. I don't know if that's happening in San Diego yet, but it's a very difficult time for everyone. And the reality is that the nursing homes don't have parallel interests with their residents or with the family members of the residents all of the time. And that makes it extremely difficult to ensure that what is happening in those facilities right now is something that we're all comfortable with.
It seems like this COVID-19 pandemic has made us look inward in every organization. So if you have a loved one, let's say in an assisted care or a skilled nursing facility, and you wanted to get them out at this point, you have no options.
For most people, there are no options. I mean, you have to understand, people don't go into these types of facilities because they want to. Nobody wants to go into a nursing home for good reason. They're really, I mean, there's some, maybe 1% are extremely nice and maybe comfortable, but even those have problems. The vast majority of these facilities are just places you don't want to be. But the reality is, at some point, people need 24-hour care. And you really do have to have a very significant infrastructure, including nursing care and visits by physicians, in order to care for some very elderly people or people who are otherwise compromised. So if you, if you did want to take someone out of a skilled nursing facility, you'd have to set that up in your home.
Be very
And
prepared.
the cost of that care, I mean, right now, I think Medi-Cal pays over $9,000 a month. And I'm guessing if you set up the same kind of care in your home, it would cost more than that. At least they have some kind of economy of scale in a nursing home facility, but most people just don't have the money to pay for that kind of care.
So how is neglect usually reported? What is the proper channels?
Most of our cases in the Nursing Home Rights Enforcement Project come from ombudsmen. And ombudsmen, I mentioned them earlier, they're the people who are in the facilities, visiting the residents and making sure that their care is sufficient and appropriate. And very often they're the ones who recognize situations where the individual residents are being neglected. They recognize health issues, they recognize things that have not been attended to, like, for example, someone may have fallen and maybe it wasn't reported, and maybe the resident will complain to the ombudsman about pain or bruising, things like that. And that's when we get alerted. Otherwise, we're pretty well known in among the district attorney's office and elder abuse enforcement in law enforcement. So we do get referrals that way as well. But a lot of it does come directly from ombudsman, or sometimes occasionally we'll get like a whistleblower type of report. But usually it's someone other than a member of the staff of the nursing home. It's almost never from the nursing home, because they recognize that the first call they're going to have to make is to their attorneys. So a family member, sometimes it's a family member of another resident who goes in and happens to recognize something going on with someone, who calls us and says, you know, we saw this terrible thing at the nursing home. But right now, none of that's happening, because nobody's visiting nursing homes, and the ombudsmen are not allowed into the nursing homes either. So it's really it's a frightening time to be in a nursing home.
So, Jamie, I know we've talked about different levels of care, and at the skilled nursing facility level, which is the highest level of care, that's obviously really difficult and financially challenging to replicate at home. But what about for these lower levels, tiers of care, like assisted living or independent living, where those people are also being neglected because they're not necessarily getting the oversight or the care that they need? Is it, and a lot of the reasons that some of those residents are in those facilities is because their family members, are working full time outside of the home, and now that their family members are home, they may be in a position where they can take better care of them. Is it possible for people to take their family members out of those facilities? From a legal standpoint, and what do you think makes sense if people feel really motivated to do that and they have the resources to do that at lower levels of care?
If they have the resources, I mean, just in terms of a social good, I think it makes sense to take anyone out of that environment, because it just seems like those are the most dangerous places for people to be living right now. You have to be very careful, though, and you might want to consult with Andrew Thompson or another attorney to find out whether or not there's any obligation for them to take back the senior when all this is over. Definitely at the skilled nursing facility level, if you give up your bed, they don't have any obligation to hold on to it for you. So you may not be going back to that facility at all if you decide that you're going to move in with family. And the same goes for a lateral move as well. Like you can't know that you're going to end up in a better place by moving laterally, and you're going to lose your bed. That, but yeah, if it was my family member, though, it's tough, because if you are in a situation where you have a bunch of people living with you, you also have to take into account that. For example, if you're a doctor and you go to a clinic or a hospital and you're seeing sick people, do you really want to bring your elderly parent into the home to live with you? That's a risk factor in and of itself. So there are a lot of factors that will contribute to a decision like that.
How overcrowded, I mean, in San Diego, you talk about a bed being open or making a lateral move. Is there a lot of space? Are you on long waiting lists for better places? How does it work?
Well, definitely if you have money, you can always find a bed, because facilities make more money when it's private pay than they do when Medi-Cal takes over payment. So if you're on Medi-Cal, that's one situation. All these things are more difficult when you are trying to get a bed that is going to be covered by Medi-Cal. If you're private pay, or you have access to money that would allow you to access a facility for at least a few months without having to apply for Medi-Cal, you can probably get a bed at some pretty nice places.
How, how does it work as far as people who go out to the home and take care of someone, and if those people aren't showing up for work, where's sort of where do those people get lost?
I'm talking
Who do
about like
they
home
kind of
home
home
health
care? Like if your home health care worker doesn't show up and suddenly, you know, what's the step there? What would you recommend for someone to do there?
If you have a caregiver that you've hired privately, or if you have in-home supportive services, and everyone's kind of in the same boat, there are people just not showing up. The call to make is to Adult Protective Services, and I know that they're taking calls and they're working overtime to make sure that there are resources made available. To tell you the truth, I don't know how they're getting people in a crisis like this to show up when there are so many other people who are just not available or not willing to be traveling. And then, we have clients who have caregivers coming into their homes, and they're very worried that their caregivers are not following state guidelines. And for the caregivers who are sometimes in their 30s and are probably not as susceptible, it's maybe not as much of a danger. But for our clients who are in their 80s sometimes, or even older, it's a big risk to have someone who's cavalier with their hygiene come into their house every day.
Right, and might
So
not have protective gear also, right? I mean, is there a certain organization that supplies that?
I don't know the answer to that question. I assume that in-home supportive services is ensuring that their caregivers are properly suited up, but I don't actually know. I haven't had any clients call about that.
Jamie, we've talked a lot about nursing facilities. What's your area of expertise? What are you working on day to day right now? What do you see coming across your desk and your home desk?
Well, COVID related, we had a very sharp drop off in client calls when everyone became very isolated, and I don't know exactly why, but we definitely have had a lot of calls that are directly related to COVID. The calls we're getting most often right now are either roommate situations where people who are living together have different ideas about what appropriate hygiene is and how careful you really have to be in the context of coronavirus. And so I've had a number of calls from people who are very concerned that either their roommates or their neighbors who are, I had one who was sharing a porch with a guy who refused to wear a mask and was going out. And that's changing really quickly. When I was first getting those reports, people calling the police were told to go away. But now the police are taking these things more seriously. Um, but I don't know, in the context of a roommate situation, I don't know really what the police can do other than talk to your roommate. And then we're getting calls from landlords, either because their tenants are not paying their rent and the landlords are, when I say landlords, a lot of our clients, they're in their 70s and 80s, and they bring in roommates because they can't afford to carry the mortgage themselves. So for roommates to decide that they're not going to pay rent becomes a very serious burden for them. I mean, the other issue is tenants.
I actually wanted to kind of go down that road a little bit with regard to renting and tenants' rights and where you know we all stand, but particularly the elderly population and what recourse people have if they have a landlord that they you know is not being reasonable. They're trying to work with. I understand it cuts both ways, but a lot of these people have no other options or no other source of income.
Yeah, it's a really difficult time, and for just to I can address both sides. We help landlords and we help tenants. The landlords, um, they're basically not going to see rent for a little while. Either they have tenants who really they've lost their jobs, or otherwise have financial issues that are front and center right now and are not paying, or they see an opportunity not to pay rent. But the reality is that the court system is shut down. And Andrew told me yesterday that the court system is shut down at least until July. So even if you do give your tenant a notice to pay rent, you can't evict them. The unlawful detainer process doesn't exist for a few months right now. So I know what landlords are doing in general is sending out letters to their tenants that offer them resources such as how to get your own stimulus check and how to find employment if you've lost your job, and also indicating that they're willing to allow a deferral of rent, but the understanding is that ultimately the rent is going to be due once we are in a place where the money is available. But for the issue more related to individuals who are not following the hygiene guidelines, that becomes more of an obstacle, because the police are not going to remove someone from their home because of that. And the court system doesn't exist right now. So there really is no recourse. And I feel really badly for a lot of these people because they're just in a very hard place. Tenants actually are in a little bit of a better place because not only has the governor issued a moratorium on evictions, but the court system is shut down, and almost every city has their own guidelines as well, which offer more extensive moratoriums on evictions and things like that. So for the time being, everyone's kind of in a nebulous place. But right now, a lot of tenants are not paying. Eventually, there's probably going to just be this huge backlog of evictions and claims filed against tenants for not paying their rent.
Yeah. Let's talk a little bit about a lot of elder scams, scams targeted towards the elderly. You and I have worked on this for patients and friends in the past. Do you see that in more of an uptick right now, and how can we help people avoid that?
There will definitely be scams related to COVID, but we don't know what they're going to look like yet. I can't say that I've had any COVID-based scam, but I can tell you that in the world of legal services, there is a lot of speculation as to what those kinds of scams are going to look like. Certainly, there are going to be individuals who will try to take advantage of different stimulus payments and people trying to take advantage of moratoriums on paying rent and things like that. The kinds of scams that we normally see, like grandparent scams, which most people have heard of, when a purported grandson or a grandchild calls and says, "Grandma, I'm in Canada. I was in a car accident. I need you to send me $2,000. Those kinds of scams are probably not available right now because everyone is socially isolated and very hard to pull that one off. But the bigger scams, like there's a home improvement financing scheme. It's actually was legislated into existence over 10 years ago, called property assessed clean energy programs. So this is something I've had 2 calls in this week actually related to this. Property assessed clean energy programs are a system by which individuals can basically get a loan to do clean energy improvements to their home. Usually it's solar, but it can also be paint or windows or things like that. But these things are sold by contractors. And what the individual well, in our case, it's always seniors, but they're sold to other people as well. But what's almost never disclosed is that these things become a first priority lien against the property. And they get, the way they actually get paid is through your property taxes. And our clients are never told that A, there's a lien against their house, or B, there's going to be anything on their property tax bill. And very often they don't realize that they have to pay anything. Sometimes the contractors say, "Oh, this is totally free. Don't worry about it." And very often 6 months later, when they get a property tax bill, their property tax has gone from, say, $1,000 to $10,000. They realize something has gone terribly wrong. So there are a lot of things in the pipeline that that are now showing up with our clients. But that's really a big one that's affecting a lot of seniors in California right now.
What advice do you have for seniors as far as, should they have a will? Should they be working on this right now? What other documents, should seniors have and, have already worked on and be readily available?
The answer is yes. Everyone should have a will, especially now. People who have significant assets usually have thought about this, but really everybody has to have some type of estate plan in place. The basic will, testamentary will, is what you're bringing up, which is something that can be used to ensure that your assets go to the people you want your assets to go to, and also avoid a small estate ending up in court. So it's very easy to prepare a simple will. The state bar has a statutory will form, and anyone can call us and we can direct them to that. Or you can have a formal will prepared by an attorney for couple of $100s. If you have a more significant estate, you should be looking at a trust. And a trust avoids probate, even if you own a home and you have over $175,000. And there are a bunch of thresholds for probate, but it really is worthwhile having that in place. And then the other things that people should have in place are powers of attorney. One is a financial power of attorney. So someone can handle your finances if you're not able to do so yourself. And the other is a healthcare directive, which includes a healthcare power of attorney, so that you name someone you trust who's able to make healthcare decisions for you and who can make decisions about appropriate care and where you're going to live and things like that. But right now, everything's being done online. So if you want to do something very simple, we can direct you to a statutory will form. It's a fill in the blank form. You just have to sign it in front of 2 individuals who will have to stand 6 feet away from you, but they can still act as witnesses to your will, and then that will be a valid will. The other way to do a will very simply is called a holographic will. That is a handwritten will that just has to be signed and dated and has to be totally unambiguous in terms of what it's trying to achieve. And that too is a valid will in every state in the country. But yeah, the basic question is, should you have some estate plan in place? And the answer is absolutely. You'll save all of your loved ones a lot of consternation and energy if you do so.
And I do want to say, add from a healthcare perspective, having advanced directives for healthcare are critical. We recommend them for everybody. And I think more critical now than ever before. And that's just a form that you can download online, fill it out, your doctor can sign it. And usually in a lot of primary care practices, we keep these on file for our patients in the event that they are unable to make healthcare decisions for themselves. And that includes what kind of care you want at the end of your life, including ventilator support and feeding tubes and CPR and lots of nuanced issues that you may not have thought about before. I have one, and just because I'm in the field and I see these situations come up where people don't know what to do when their loved ones are in this really desperate situation and you haven't had a conversation before. So we can link on our site. Well, Jamie, you can send me your links and we'll add ours as well, where people can go and get this information and download it and kind of start having those conversations and they're good at these are conversations we should be having all the time. But they're hard to have because we don't talk about death and dying in our society very much, but it's important that you have a voice in that when you can't.
Well, we talk about it a lot now.
Well, we do now.
Unfortunately.
Yes. Yeah.
Well said, both of you. Thank you.
But the financial power of attorney is really important. And one way to illustrate that is basically, while you're alive, if you want to name someone who's able to act on your behalf for financial matters and able to make financial decisions for you, you can fill out, usually it's a 1-page form that gives someone the authority to do so. If you don't fill out that form and for some reason you lose capacity, there's nothing between that and a conservatorship. And a conservatorship is a guardianship that requires going to probate court, informing everyone that you know that you've lost capacity and that someone is seeking conservatorship. And then it requires court oversight indefinitely. And there are all kinds of costs associated with it. So putting a financial power in place, putting one of those financial powers of attorney in place in order to avoid a conservatorship does everyone a huge favor. So there are many more reasons to do it, but everyone should be doing some basic estate planning.
Good advice. Thank you.
What else you got, Annie?
I feel like I kind of rattled so many off. I feel like
Jamie, let's anything else that you think it's important that everyone know at this time? What other pearls of wisdom can you share with us?
Well, I think it's really important for seniors to be a little circumspect. Like if you are wondering whether or not something is a scam, call our organization, we will talk to you for free about what you think you might be getting involved with. Because we see so many scams, we see people who are involved in so many different ways of being victimized, that it really does make sense just to check with someone. And I know the fact is that people who are seniors who have their children very involved in their lives very often don't have these issues because their children are kind of keeping tabs on what's going on. But when you're really isolated, and isolation now goes beyond any isolation we've ever seen before. So there's going to be all kinds. Isolation is the key ingredient to victimizing seniors. So if you think you're being victimized, if you're unsure about someone who's trying to contract with you in some way, or someone who's befriending you and offering to be your agent on your power of attorney, call our office and have a conversation with one of our attorneys, and save yourself some money and some grief.
Yeah, and again, Jamie's office and Jamie's work is outstanding. We've known each other for a really long time, and you work for an amazing nonprofit, and you've helped so many seniors over the years that I personally have seen, and I know you do such great work. So we'll definitely put all that information out there. Any other final thoughts, Annie? Questions?
No, thank you so much for answering questions, Jamie. I know it's a really busy time right now.
My pleasure. Thank you for helping to spread the word.
Thanks, Jamie. Have a good rest of your day.
Thank you. You too.